to the American Journal of Psychiatry Residence Journal podcast. In today's episode, we're going to be discussing podcast for psychiatry residents and medical students interested in psychiatry. I am Neal Christopher, your host today. I am joined with Badr Raknakaran. And why don't you tell us a little bit about yourself?
My name is Dr. Badr Raknakaran. I'm a third-year resident at Virginia Tech Carilion School of Medicine. I'm interested in teaching in academic psychiatry, and my future pursuits would be geriatric psychiatry fellowship and possibly consultation license psychiatry fellowship. Bit more of my background. I come from India. I used to be a psychiatrist there. I practiced psychiatry for 4 years, and in total I have worked in the field of mental health for 8 years, part of which being for a year I taught residents and medical students in my own medical school as an attending. So that's why my huge interest in teaching psychiatry comes from.
That's very cool. So you were faculty, it sounds like?
Yeah, I was a former faculty.
And I don't know if I've formally introduced myself before. I'm currently serving as the chief resident for our inpatient unit and as co-chief resident of our interventional psychiatry service, which includes primarily electroconvulsive therapy, but also transcranial magnetic stimulation over at the VA. A kind of split passions there between, in some ways, the sickest patients, and in other ways, focusing on access for community psychiatry context. Badr, what are some of your favorite podcasts?
So I primarily listen to things that catch my interest. There are a few podcasts I frequently listen. One is the Psychopharmacology Updates, MD Edge, Mad in America, and Psychiatry and Psychotherapy by David Badr. There is a podcast that's out of the line of education. It's called Capes on the Couch When Comics Get Counseling. That's an entertaining podcast if superheroes were your psychiatric patients. And there's a guy who acts as a psychotherapist for them and talks about them and their problems.
Yeah, and we had the interview in an episode last month with Dr. David Badr, the host of Psychiatry and Psychotherapy podcast. So feel free and go back to listen to that episode if you have not already. We probably won't cover that one as much. It is a very well listened to podcast. Of some of the others you mentioned, any particular episodes that stand out to you?
So in Psychopharmacology Updates, there was an episode on transdermal use of antipsychotics, which was unknown to me. And I'm not sure we had any too much advances in it, but they were talking about the possibilities of using antipsychotics as to delivery of transdermal patches. There was talks about trying the haloperidol patch, didn't work out due to inconsistency in the delivery, but it still seems like a very novel idea. Kind of thinking it as a short form version of the long-acting antipsychotics. It was a pretty interesting thing. I think if somebody can build on research on that delivery mechanism, it would be very useful for patients.
I agree. I love that episode as well. And I do listen to that one. And this one is from the Psychopharmacology Institute. They do have a paid product, but what we're referring to is the free for anyone to download podcast. I don't know if you listen to the NEI, the Neuroscience Education Institute's podcast. Do you listen to that one?
Yeah, I did their course too, and I also use their podcast. Listen, it's pretty good to learn about basics of psychopharmacology. So if you don't have time to read the textbook, I would say, or have difficulty reading the textbook, I would say that's a good supplement to your educational resources if you have time.
Yeah, it seems like NEI is becoming a version of core curriculum that we are all listening to, either going through the textbooks or the online course or the podcast or some combination of that. Now, the American Psychiatric Association has a number of podcasts. Do you listen to any of those on a regular basis?
Just recently, because around April, March, they started having some regular podcasts. Prior to that, they were just having the highlights of each issues. The reason I started listening to them was because there was one around May. There was a study by Dr. Madhukar Trivedi where they were thinking of whether should we add irritability as a symptom to be considered in depression as a part of the dysphoric mode. And I believe there was a clinical trial based on that, and that I'm not sure if they were checking the validity of the phenomenon, but it was an interesting idea because a lot of the depressive patients have dysphoric mood. They are like social isolation. And in your day-to-day life, you can see that leave me alone kind of symptomatology coming up. And that was an interesting thought. One other interesting podcast that came out, I think it was last month, was about negative symptoms in schizophrenia and how they were doing some functional neuroimaging on the prefrontal cortex. There was a theory that the prefrontal cortex might be involved in the negative symptoms with the motivation and hedonia, but they were able to do functional neuroimaging on it, and those findings were pretty interesting.
Yeah, those do sound good. And just to be clear, we're talking about, I believe it's 4 different podcasts. One is The Medical Mind, and that one is focused on kind of current news or innovations in mental health care. The next one is Psychiatric Services from Pages to Practice. And that one, well, what they say is research recently published by the Psychiatric Services, which is, of course, a website and an email probably a lot of us get if we've ever joined the APA. Sometimes I find it easier to listen to some of these things by running, and then whichever ones I'm interested in, I go back and read. But those are nice reads that are easier to get through than your longer articles when you're on your busy services. And then we're also talking about Psychiatry Unbound. Now, I haven't listened to this one as much, and I believe this one's newer, where they're interviewing authors of the books that they're publishing. Have you listened to any of those episodes?
No. The podcast I'm referring to is the official podcast by the American Journal of Psychiatry. And I'm also in the editorial board and a reviewer from multiple journals, and we always talk about how do we increase our marketability and reach to the audience, especially future authors. And the adoption of podcasts, I think, is a trend where journals are trying to diversify the way they reach out to the audience, especially disseminating their scientific evidence or literature. American Journal of Psychiatry is starting to catch up on it. Earlier, it used to be just highlights on it. That's why I never looked into it. But when I went to the website and saw the interview of the authors, and that's when I realized that they started also doing the podcast.
And I agree with you completely. It wasn't just, I think we're referring to the main podcast, which is the American Journal of Psychiatry Audio, AJP Audio.
American Association of Geriatric Psychiatry has started catching up on it. I think they had 2 or 3 podcasts out right now. Journal of American Medical Association, the psychiatric subsection, and Lancet also have podcasts of authors on their research papers in psychiatry. So different journals are trying to catch on the trend.
Okay, there are some others that I think are good for earlier in training, so starting in med student level and continuing through early residency. And the main one that I have in mind here is one by Sara de Leon, Concepts in Psychiatry. So I just found this one this year, and I think her podcasts are very professional. And then her basic episodes, particularly surrounding diagnosis, have PDFs that are available on her website. So if you are a 3rd or 4th year med student or an intern, perhaps, I think her topics are great. Also, I recently listened to an episode from her. I think it was on Alpha 2, and I thought the summary was fantastic and would work for even higher levels of training. So she's doing a great job with that podcast.
Yeah, if you're dealing with medical students, the content of the podcast should interest them and should be so. I wouldn't use the word simple. It should be saying that it's comprehending for somebody as a medical student so that he can verbalize it to his colleagues or somebody expecting education from his level. So if a medical student is listening to a podcast from American Journal of Psychiatry or the Lancet, he or she might not be able to grasp what the importance of that research is. But at their level, we are looking at symptomatology and basics of psychiatry. If those podcasts are there, it could be also useful for residents to teach to medical students using those podcasts.
I think that's exactly right. And I'm one of the residents that is called in our program at times when it is time to go deliver a lecture, particularly if somebody couldn't show up or something got moved around. And one of my secrets is I will instantly search for some other expert and whether they've done a lecture in that area. And I will then utilize that as a big portion of my quick preparation. Now, have you ever listened to SAGE, Psychology and Psychiatry?
Yes. I found it useful as if you're going on a drive, because most of some of their podcasts are like short snippets, probably around 10, 15 minutes. There was a podcast called Trainee Welfare about the wellness of a resident related to burnout. I think that was a good podcast about how a resident should also take care of themselves while they are, trying to gain that improve their professional skills and skills as a physician. You have to take care of yourself while you're taking care for others. And that was one podcast I think was really good. It was around 10 minutes. And that's an example, like if you are on a drive or going to work, like if it's 10 minutes or 15 minutes, some of these podcasts are really short and help you get the summary of the topic. And if you want to expand your interests, these podcasts, a lot of them deal on very non-traditional topics too. There was a podcast on, if I remember, on psychodermatology. That was an MD Edge. And if you don't encounter those topics in your day-to-day life unless you're in a consultation as an outpatient setting and the dermatology department sends you a patient, or you encounter a problem where there's a dermatology condition that might be affected by a psychiatric medicine or has a psychiatric component. So it's not, you get those exposure every day, and you might not have the impetus to read on those topics unless you're preparing for your boards. So hearing them once in a while might, you may never know, you might get interested in that area, and that's a niche area too.
Yeah, I think that's a really cool point, because with podcasts, basically we are expanding our ability to listen to instructors and specialists in areas that we may not have in our own programs. And so it's a really easy way to get knowledge and even like tele-mentoring, if you will, from afar and on our own time, which is often hard to find in our own programs, much less from, like you said, a niche that we are underexposed to or that we just simply don't have available in our program or even in our geographical area. And so for residents in particular, I think it's important to listen to a few podcasts on areas that you might not consider, because you might find yourself more interested in them than you thought, and that might start a specialist journey for you. I ended up doing a 3-month elective rotation as a second year at our local state hospital, which is a 100% forensic population. And so that was one of my more enjoyable experiences early in residency. And I only chose that because I had previously listened to some podcasts. I would have never had exposure to that area otherwise. Now, UC Berkeley, I believe, has one with both audio and video called Mental Health and Psychiatry. Have you encountered that one at all?
No, but what I think is similar is the Massachusetts General Hospital Psychiatry. If you go to a bit of the older episodes around 3 years or 4 years ago, they had their webinars also streaming in their podcast. If you're using I use an app called Castbox, and in those you can see their webinars, the speakers also sitting in there along with the slides while the podcast is playing. So the one I remember right now was one on postpartum depression, where they were talking about their research and the slides, which is helpful if you, because the podcasts are basically the recordings of the grand rounds or their webinars, and sometimes if you don't have the video or the figure, you might not understand what they're talking about. So that's helpful in those cases, but I don't see them very often nowadays.
Yeah, those are two good ones. I do listen to MGH and the University of Oxford, which also has one that is no longer updated directly. And those are my favorite too. And I believe it was MGH that had one on the neurobiology of PTSD. I think that was an older episode. That was one of my favorites, and also one on long-acting injectables. That was a really good one to listen to.
Coming to that point, one of the good things about those podcasts, you get to hear a lot of prominent personalities in psychiatry, like Dr. Papakostas in depression. I think MG had shared a podcast on that. There was one on Dr. Theis on treatment-resistant depression. So that's a good way to hear these great researchers speak about their work.
That's right. And you've also listened to a lot from Columbia, right? Which also has one that's a little, I think it retired as well.
Yeah, it had been 2-3 years ago. Columbia Psychiatry, the podcast is still up there. It's mainly they had a radio show called Blog Talk Radio, and they talk about various topics in psychiatry, include suicide, transcultural psychiatry. Those were really good, very traditional psychiatric topics told in a very simple manner. So the format, again, the radio quality is more radio show quality. This is a bit grainy, but the only problem with that is probably 4 or 5 years old since they have updated it, which seems sad. They were pretty good.
I occasionally will also listen to a podcast that probably most of us are not listening to, but are you familiar with Mad in America?
Yes. Yes, I do. Psychiatry has this very colorful history, and it's again based on the perspectives. The anti-psychiatric movement is not as it's not as open as out there. I remember in the past when you went to the APA conferences, you would see the anti-psychiatric movement. I couldn't attend the APA meeting in San Francisco, but I did attend the previous one in New York, and the one in Atlanta. In Atlanta, I did see an anti-psychiatric movement, and I didn't see that in New York, even though one of the venues was right across the street from a Scientology church. There was no protest or gathering. But Mad in America, some people see it as an anti-psychiatry podcast or they have a website too. But I beg to differ a lot. Their website contains mainly against how psychiatric services are provided, in the view that many of the medicines are not working, and we still try to push for medicines where you should look at providing a holistic or wholesome care, and that website or podcast, the themes of their ideologies about how about providing different services of care? How about looking at psychiatry a different way? Our stream of medicine has a lot of loopholes and flaws in it, and it's also very much dictated by how people view psychiatry, how politics view psychiatry, and how much care we can provide in psychiatry, and that. Their main agenda is looking at different perspectives and providing how psychiatry should be viewed and how psychiatric care should be provided. We may or may not agree to it because a lot of their viewpoints are not from a physician or psychiatric standpoint, but as a resident, it is very important to develop those perspectives too, so that you know your weakness and you know your strengths too.
Yeah, I agree. I think it's our minority report, if you will. It's that third voice that is going to differ significantly, probably from the mainstream of evidence-based psychiatry that it is being taught in most of our major centers. At the same time, it's a voice that is not so different that we can't learn from it. In fact, it probably will help keep us help keep us honest, help keep us pushing for more evidence where we can find it. And when we do reach a point where we're not seeming to help anymore, to help us broaden our perspective to look for other options. And so I don't know that I can listen to a lot of episodes in a row or binge listen to this one, but it is one that I do listen to selected episodes and find it moderately challenging at times.
It's kind of like you're viewing the Rosenhan experiment in 1960s. That's how the psychiatric is practiced. For if you're sitting on that standpoint, you have your opinions and views, whereas the patients on the other side, or Dr. Rosenhan was the patient who did have an agenda that I do agree, but kind of like exposed our flaws at the same time too. So it is very important to know there's an anti-psychiatric movement and there's a different perspective of psychiatry outside the residency, and it's very important to form our understanding of it, because we should know who we are as a resident and when we become future physicians, and the challenges that our patients or providers can bring to us, that hey, what you might be doing, it may not be right, or there's a different way to do it, because it makes it become flexible in our views too.
Absolutely, yeah. I mean, and the patient themselves may have a certain perspective that's similar to one in the anti-psychiatry movement, or their family members or friends. Some thought leader for them may very well have been more influenced that. And so if that's the case, then the conversation is going to need to be very differently at first if you hope to have any success with them. Being in Southern California, we are well aware of Scientology and their influences. They had a pretty big presence at the San Diego APA. They did have a presence. It was intense for a few moments. It didn't last very long in San Francisco at the annual meeting, but I think it is part of their agenda typically to have people there and protest things. And I do a lecture on the history of electroconvulsive therapy, and I show some audio clips from a couple of previous decades, which show how the opinions that are basically still there as part of this. And it's so interesting to be a psychiatrist and to know that we are basically the only specialty that has a movement against us as a specialty. There's nobody out there protesting, there's no anti-dermatology movement. There's no anti-ortho movement. People are not saying stop knee surgeries now, but when we go to our conferences, they're there and their opinions are strong in certain circles. And I think we should be aware of them. So interesting side point that I think is important for our education.
And it's not a small podcast. If I remember, there are over 100 episodes. Some of them are pretty valid. I think that there was one on psychiatry and sexual abuse and the intersection in psychiatry. There was a podcast which is true. If you look into some of the psychiatric institutions that practice always a psychiatry, it still happens, even though we kind of like have deinstitutionalized it. It's a reality. It happens in some places. That's where we have to see. Some people do see psychiatry as a tool of coercion and control. Some countries do, like places like China, they do use it as a tool of control. So we need to know how psychiatry is being viewed in different cultures and different populations, and that's a good podcast to let. You might not agree or you might disagree, not disagree, but it's important to know what people on the other side think of us too.
Have you ever listened to? This is a newer one that is from the Harvard McLean people, Mindful Things.
No, I didn't know. I haven't heard of it.
They cover a wide range of topics. Is one of those that you can definitely listen to when you're in more of a experience type mindset than maybe a learning type mindset, because there'll be a little bit of learning, but mostly you'll be getting a sense of what it was like for someone who needed mental health to get mental health, and it's very entertaining as well at times. What about JAMA Psychiatry Authors?
Yes. So James Psychiatry Authors podcast is something I would also recommend residents to hear many times. So this is where how podcasts sometimes can be useful. When you're a resident, you're working, you're tired, going through articles and reading articles is sometimes very cumbersome with the language. And JAMA and Lancet have their podcast based on the interviews of authors of their major research articles, and it's very simple to listen, and they talk about their major findings about it. They also have articles not based on research. They also have podcasts on their views. There's JAMA Psychiatry had a podcast on Association of Increased Youth Suicide with the show 13 Reasons Why, which was interesting because somebody actually decided to look into the suicide rate after that show came out. And when the authors talk about their research, they talk it in a very simple way so that you can understand it. And maybe residents can pick up those articles for their journal clubs, how it's important.
Now, as you're aware, in psychiatry, we have different skill sets. A big focus of what we have to offer is biological medicine, and then more intensive interventions like ECT. But we spend an awful lot of time compared to our physician peers in other specialties with some of our patients. And some of us utilize anything from supportive therapy to cognitive behavioral therapy to psychodynamic approaches and even more specialized types. Have you listened to any podcast that you have found particularly helpful on the psychotherapy side?
I usually go to Dr. David Puda's site podcast because he has a lot of podcasts based on certain issues that you face in psychotherapy, including transference and countertransference, boundary limits, and empathy too. There was an episode on empathy that was excellent. So those podcasts are very, very helpful as a resident, because again, when you're reading those concepts in your textbooks, they are pretty long and they talk about a lot of issues which can sometimes be tiring. And Dr. Puder's Psychiatry and Psychotherapy podcast is pretty good on talking about some of those issues. It's not a replacement for those textbooks. It's just some areas, if you're running out of time to understand the gist of it, some of those podcasts are pretty helpful.
Yeah, I agree. And you can definitely do worse than starting out with Dr. Puder's podcast. I also have developed a little bit of an interest in incorporating brief therapy into my med management appointments, particularly in a community context where the waiting time for a psychotherapist that can be 4 to 9 months, at least here in Southern California. So on the cognitive behavior therapy, I actually listened to David Burns, who is the author of Feeling Good. He has a podcast where he goes over quite a number of his CBT techniques. And so it is called the Feeling Good podcast. It's a bright yellow logo, so it's easy to catch in your podcast feed when you're wanting to brush up on a technique really quickly. And some of them are pretty intensive if you don't have an interest in CBT, but you can literally start at the beginning and start working your way through it and find that you're developing your own training, increasing your skill in CBT just by going through that. I also have an interest in Acceptance and Commitment Therapy, or ACT. And they have an older podcast that they relaunched. And I've listened to the old one all the way through a couple of times. And the new, or it's the same name, ACT in Context. If you're not interested in kind of going beyond CBT, you might not find that very exciting. But if you feel like you've got a good handle on some basic techniques and you want to consider another alternative to another style of therapy, then that might be one that you're interested in. There is another one that's kind of interesting called Psychologist Off the Clock. And basically it's three psychologists who kind of discuss different perspectives. There are a huge number of psychology podcasts out there. A lot of them are older, and then now there's some newer ones that are coming on board as well. And the quality can range quite a bit, both in audio and in terms of what they're trying to do, whether they're just presenting personal opinions as a licensed psychologist, all the way up to the latest research from the American Psychological Association, which has their own podcast as well. And so we will have the links in the show notes to some of these, but I can't attest to which ones you might find interesting for you. So we're talking a lot about different kinds of podcasts. Badr, how much time do you spend listening per week?
I would say on an average of around 3 to 4 hours. And it's usually, there are different times where I listen to this podcast. One is sometimes when I'm running on the treadmill in the morning for half an hour. Some of the podcasts are like half an hour or 15 minutes, so you can listen to one or two. The most I use the podcast is when I start writing my notes. So while I type in notes, if I want to distract myself from what's happening around me, or just would like to listen to something while I'm typing, that's when I use this podcast. And sometimes on drives, if I'm going to a facility where I have at least a 20, 30-minute drive, I might put one on if I'm in the mood.
Now, are you wearing headphones, or are the junior residents having to listen to what you're listening to?
Depends on the medical student and on the resident who's with me. I would ask him, would you like to listen to it? But mostly I use my headphones.
That sounds fair. I think most of us do listen sometimes when we're driving. I have about a 16 to 18 mile drive, which can be anywhere from 16 minutes to 50 minutes with traffic. So I typically put down an episode a day going one way or the other, and then also to moonlighting and back home at night. Although, quite frankly, when I get to the end of the day, I'm usually listening to more entertaining audio and less of the psychiatry podcast. What do you listen to for fun?
There's a podcast called Neal. It's by a guy called Jim Deduk. He's been around for a couple of years. It's pretty popular outside of the US. It's basically this guy who talks about how popular culture has been influenced by various things in our history and things around us. Like, he would talk about video games and how it's influenced by various events in history. There was an episode where he talked about the comic Batman by Gaslight, and he was talking about steampunk and its influence during the World Expo in Paris and if I'm correct, in Chicago. It's a very interesting podcast.
Okay, Badr, what would you say are your top podcasts that you must listen to?
My top podcasts would be definitely Psychopharmacology Updates. There's a podcast called Psyched. It's by two psychiatrists. They don't update very often, probably 1 or 2 episodes in a year, but they do talk about very interesting topics like TMS, treatment of schizophrenia, and they do it in a very entertaining way. It's very lighter in content. They're not extremely verbose or using a lot of scientific jargon. For easy listening, that's a very good podcast. Definitely JAMA Psychiatry Authors. A couple of other good podcasts I listen to is podcast by DMD Edge journal. If anybody has read MD Edge, you'll see they have a lot of good articles on a lot of topics in psychiatry. It's more like from an educational perspective. There's a podcast called Carlet Psychiatry, Carlat, and they have publicized themselves free of any pharmaceutical agencies' influence, and they have some good topics to listen to. Some of them can be a bit monotonous and dreary, especially the older podcast from MGH. SUNY Downstate has also one, and they were just grand rounds. Some of the newer podcasts are good, easy listening to the ear, not dreary, dry to listen. And many of them are really short, 10, 20 snippets that capture your interest and just of the topic very fast. It's a great way to learn if you're running out of time. A lot of us find it difficult to get through didactics, and we may not have the faculty to cover all the topics, and some of them can be a good supplement.
And I think for me, my top podcasts depend on who you are. For instance, if you are early in your training, I think Concepts in Psychiatry is a great place to start. And I also like the Psyched podcast that doesn't update as much. I also like the one that we're doing now. And I think that the Residence Journal podcast will continue to grow, and we will continue to have topics that are relevant for people in training or considering psychiatry as a career. I think for those listening in article summaries, there are the three main podcasts, AJP Audio, The Lancet, and JAMA Psychiatry, that need to be listened to on a regular basis. And I think for those who are just have general interest in psychiatry at this time, they could consider The Medical Mind, Dr. Puter's Psychiatry and Psychotherapy, and then the Psychopharm updates as must-listens.
Here in Virginia Tech School of Medicine, students are allowed to learn from their homes. I think institutions, including residency programs, when they are time-wrapped to take classes due to the clinical duties, should be looking into sources about learning through audio or podcasts or simple ways to teach psychiatry. In that perspective, in our current environment, how much technology expanded, audiobooks or podcasts are a great way to learn in your free time. And if you really want to listen to certain topics, niche topics, they're also a great way to look out for. The only thing is this medium of communication about psychiatry is still in nascent phases. So expanding, but Dr. Christopher said audiobooks is one. If you have a good time, I know a lot of doctors and physicians who listen to audiobooks. One of my favorites is Neurotribes. It's based on autism. We probably are looking at, in the future, you're looking at more shorter podcasts, 10-minute podcasts. So I'm just interested how that will be expanded in the future by a lot of journals and probably authors too.
I think you're right. It's going to become more important to have a collection from resources that you trust that are shorter to get current information or what are the articles that you may want to get to, but also to have some that are exposing you to different ideas that you just may not have time to read, but you would like to at least be aware of a difference in opinions or perhaps a new field or modality or specialty area in psychiatry that you wouldn't consider. And you may not have access to the faculty that do that, but you can listen on your own time. Do you think there's any areas of caution of people listening to podcasts? I know when we talk about reading articles, we worry about certain kinds of things. What are your concerns for someone just subscribing to 20 or 30 podcasts and they start listening?
Number one caveat I would have to give is knowing whose podcast this is, just like you're reading your articles, your research papers, you should be aware of whether there's any conflict of interest. Because the podcasts are done by one person's perspective, and there might be a bias, and there might be cherry picking on the data or what they want to talk, and that can be a problem. And when you're listening to 20, 30 podcasts, the tone and the agenda of different podcasts can be different, and that might take you down on a spiral, which might disillusion you on this podcast. So stick on to a few, especially if you like us, like American Journal of Psychiatry, JAMA, Lancet, Journal of Clinical Psychiatry is another one I like. They have highlights, and I think in the future they'll be coming out more podcasts from their authors. The biggest thing is, are you able to grasp what you're listening, what you're learning? Not just nitpicky details. Are you really learning from what they're talking about? Are you able to, just like a journal club, are you able to look at the strengths and the weaknesses of those podcasts? And would you recommend it to somebody else? That's also another factor you should look at.
I think with audio, it's interesting to remember that many of our podcasts are summaries of an article, and in some cases, they're summaries of summaries. And so if there are some implicit biases, they might be heightened by cutting out more and more. The biases might actually become stronger as you get summaries of summaries. And so I think that's a good cautionary statement. Okay, Badr, thank you so much for your time. I appreciate your thoughts. Hopefully this episode has expanded your catalog of options that you could listen to, both focused on medical aspects of psychiatry and possibly even some psychotherapy as well. Browse through the show notes. You'll see a lot of links there, and be safe if you're listening while driving. We'll see you next episode.